I graduated in 2005 from Kansas State University with an interest in small animal medicine, and since then have grown to enjoy a few different areas. I like dentistry. That's been very interesting for me to learn about the ways that we can help in that arena, because it's really becoming kind of an important thing. Well, it's always been an important thing, is the odd thing about it, but we're recognizing now how much help can be done through dental health. And I think that's one of my favorite things about working down here, is the broad range of things that we can do to help is larger than it was back up north. It's just nice to feel useful and helpful, and that's really why I got into this profession in the first place. So it's been overall a very good thing for me. Back in South Dakota, we were kind of out in the country, and there was a lot of farms around, dairy cattle, regular beef cattle, and pigs, sheep, goats, everything like that. And so the veterinarians in the area that I rode around with just to help out, as I was volunteering with them, I learned a lot about all kinds of different aspects of veterinary medicine, because they would do small animal things too, and I got kind of a broad range of experience with them. But the farm calls and things were really kind of fun, because they were neighbors, you know, there were people I knew from school, from high school and whatnot, and they were farmers and friends. So helping them out was just a good introduction to the whole thing, I think, and was a positive experience for me. Plus working with the doctors and seeing how good they were and helpful, and just seeing that it was a profession where you can make a very positive contribution to society and still be compensated for that, and live a healthy lifestyle. That's what I was looking for. We work well together, for one thing. The team has a good cohesiveness to it, mainly due to the leadership of Dr. Becker. I think he's been doing this a long time. He's taken the 20 years necessary to build up not only a good team, but a great following amongst the community. Everybody knows him and respects him, and that paves the way for us to do our job a whole lot better and easier, due to all the hard work he's done. And the facility is fantastic. We're really lacking nothing when it comes to what we have to offer. I never find myself in a situation where I feel like I could have helped more had we, you know, had a better piece of equipment or more access to medicine or anything like that. It's really kind of, we feel here like we can help. Oh yeah, we see all kinds of crazy things. There's snake bite dogs that come in frequently, porcupine quill dogs. There's dogs that come in covered in trauma, you know, cuts and bruises from dog fights, and it's always just kind of amazing to me how well the clients, the owners of these dogs down here deal with all these things, because it is tough sometimes, you know, not only financially, but it can be traumatic sometimes when bad things like that happen to your best friend. That's one of the things that I try and focus on, is recognizing that there's a human aspect to this job too. It's not just all about the pets, you know, we have to take care of the humans that are attached to them. And if you do a good job of both of those things, then I feel like you can go home at the end of the day feeling good about the job you did. Euthanasia is always a very difficult thing. That's my least favorite part of this job, without a doubt. I do appreciate the fact that we can help a pet have a dignified, pain-free death. I think that's an important thing, because a lot of times natural death is not so dignified and very painful, and we can at least help with that. If we can do nothing else, that's the one thing we can do to help. So although that's maybe the worst part of the job, at the same time it's a necessary part, and it's still, in a way, it's helpful and a good thing to do in certain situations.